All right. Hello, everybody. I'm really excited. I've been waiting for this for a long time. This is podcast number 2 with Dr. Emma Abramyan. I'm sure you've all heard me talk about her probably every live stream because she's a very special dentist. And I hate the word dentist in her case because she's more of a head doctor. But it's not it's not just oral medicine because and I went to her personally as a patient, so I can tell you that teeth in the mouth is one part of what she does, but she starts with you have this thing called a head, and it's made up of all these bones. Anyway, she works with everything, so I was really impressed. Now I know other dentists do that, other biological dentists do that. Regular dentists, unfortunately, are kind of like in my view, okay, in my view, they're like mechanics, right? They open the hood and they go in there and they change the oil and they close the hood and then they walk away. But biological dentists say, wait a minute, these teeth are in a head, and that head, so they look at the whole thing. But again, they still a lot of them will do biological dentistry, which means supposedly that you're using biocompatible materials and you're trying to work with the biology of the person, and then they'll give you antibiotics or they'll give you some sort of opiate narcotic or something like that. So she never does that. She uses essential oils. She uses whatever she can that's natural, that can enhance the healing, and that's fantastic. So anyway, let me just really remind you all that this is Dr. Emma Abramyan. She was born in Russia, raised there. She was kind of smart, so she skipped the 4,000 grades and wound up going to medical school at age 15, and then went to dental school, and then she did oral surgery fellowship. She did orthodontic fellowship. Wound up moving to America, probably the biggest mistake she ever made. But anyway, she went to America, and she had to go to dental school again because that's how America is. Anyway, so she went to dental school again, but now it's still been 14, 15 years, whatever, that she's been, doing this. And the beautiful thing is this, that in Russia, where she was trained in medicine, they actually, you see, Russia and a lot of the Eastern European countries that were considered behind the Soviet bloc, and Cuba, all those countries didn't have access for decades to big pharma, so, like the Western world did, and so they had to use other things. So when we look at ozone research, it all started back on the behind the Iron Curtain. So in Russia and Cuba, all the old ozone research that I read comes from there. So they were doing it for a long time. So for when she went to medical school, it was kind of normal. That's what they do. Over here in America, it's considered you're a quack if you use ozone. It's crazy. So, but anyway, so it was really easy for her to incorporate that into her dentistry, and for her to slide into biological dentistry was it's just completely natural. So she did, and then but she's also very spiritual and very she understands the physiology of the body, so that our bodies were actually designed to. Everybody has to, I'm always offending people, and that's okay because whatever, people, some people still think that humans are supposed to eat corpses, and I have conversations all the time with people, and it blows my mind that they think we were just this one guy yesterday. Oh my God, from you guys, he's from Brazil. Yeah. Anyway, the poor. Yeah, I gotta have my meat. So anyway, so she knows all that. So that's the beauty of it. It's so hard to meet that. So I was fortunate enough to meet Dr. Emma Brahmayan through a mutual patient, and we've worked with her, and we've worked on several patients since. And so I'm so happy to have her here. Emma, thank you for coming. Really, very happy.
Thank you. Thank you for having me. It's a privilege to work and collaborate with you and being part of this journey and seeing those self-healing journeys. Thank you. Thanks for everything you do, Dr. Lodi. And yes, as a part 2, today we're going to talk about infections. So I want to share with you some slides, and then we can discuss and go more in depth. Okay?
Great. Excellent. Excellent.
So let's start with sharing. Okay. Okay. Can you see?
Okay. Right. There we go. Yeah.
So just a little bit of review. Holistic dental medicine. What would be the difference between holistic dentistry and conventional dentistry? Well, at a core of it, it's about improving overall health through oral intervention. So we're treating the whole person at all three levels: mind, body, spirit. We try to minimize harm, minimize use of toxic materials, and view the mouth. And I want to point out not just the teeth, the mouth, and all associated structures as they relate to the rest of the body. And today we're going to concentrate on infections, but we've discussed with Dr. Lodi at some point, covering more about spine alignment, how it starts in the mouth, airway, oxygenation. It also starts in the mouth, upper airway, and incompatible restorations, metals, and what's not. So again, let's start with basics, right? So anatomy. We know the teeth looks a little white pearls in the mouth, but as a matter of fact, they have all teeth are organs. They have their own lymphatics, own blood supply, and nerve supply. And you probably have heard of acupuncture meridians. And interesting fact is they all start in the mouth. They start with teeth. And then every meridian will go through certain teeth and organs. So for example, here on the slide, you can see number 19. This is your lower molar on the left side, the first molar. It goes through the large intestine meridian, lung meridian, and you can see different joints in the body and glands. Why are we mentioning that here? Because by extension, we know that oral cavity is part of a gut, right? So it's the beginning of the gut. I do know that those of you who follow Dr. Lodi, he speaks beautifully about gut health being a holy grail of your overall health. And it's a 30-feet muscular tube that starts in the mouth, front door, and there's a rectum, a back door. So by extension, every time you swallow, you extend the microbiome, and we're going to be talking about what it means to your gut. So you extend the pathogens such as bacteria, parasites, fungi, into different compartments. But another way of spreading will be not going through those energy meridians, and think of it as a highway. In different cultures, it could be called different names. It could be called prana or chi, energy. In science world, we call it electron flow. So if you have any type of infection in your tooth, what it means is those organs on the same meridian, they don't have enough energy to self-heal. Our body are built miraculously. We have a capacity to regenerate. But since we have this stopper somewhere along the meridian, those organs don't have enough support. So that's why we talk about biological dentistry, where we address the issue in the mouth. And there's those organs, with the help of someone who's very comprehensive, who understands all the intricate connections with the overall health, you can heal. You can start undoing the damage.
Dr. Emma, excuse me one second. I wanted to, for those of you who are, who are new to that meridian concept, by the way, the Chinese have known about this for 5,000 years at least. And I first got it, I first saw it when I was in medical school, and they brought some anesthesiologist over from Beijing, and we were doing a C-section, and no drugs, they put four, I forget how many needles on each side of the abdomen, and we did a C-section with, she was awake, no pain. It was just, so I said, whoa, wait a minute, these people know something that we don't. We don't have the words, we don't have the concepts, but I can't deny what I just saw. So then I've come to realize that when she's talking about meridians and the different organs, the way it's easy for us Westerners to think is like, if your bathroom light, your bedroom light, and your kitchen light go out, and then you find one fuse, you put it in, they go back on. So that's kind of like a circuit, right? So in our body has got, we've got 100 trillion cells, 60 trillion cells, and they all talk to each other. But anyway, those are the circuits. So just, I mean, it's hard. People don't know the word meridian, but it's really not woo-woo.
Well, yes, I agree with you, Dr. Lodi. I actually have a next slide. I will come back to it about the circuits, but this is how I think you're right. It's easier to visualize it with the light switch and the circuit moving electrons or energy or electricity, whatever it's easier for you to understand, or not. So what could be this block? This block could be infection in the tooth. It could be metal restoration. It could be root canal. It could be cavitation. It could be gum disease, specifically around certain teeth. It's more so, it's a lot of bone loss or gum loss. And I mean, all those things will create a block. Another thing that we don't talk enough in dentistry is emotional baggage. It's also, this is the area where we store our emotions, our joints. And we're not going to concentrate on this topic today, but it's also will be a stopper for block for your energy flow. Now, just to get a basic understanding, it's very visual, the slide, but I do like to make it very clear. On the left side, you see extracted root canal. All this red pus and the black area on the apex is a gangrene. Now, a gangrene is a dead organ that doesn't have microcirculation. It's cut off and the area dies, right? So for some reason, when there's a gangrene, we always talk about toes, with gangrene toes. What do you want to do? You want to cut it out, cut it out, cut it out, so it's not going to spread. But when it comes to your teeth, the concept of saving teeth at all costs, even if there's gangrene, it's okay. Just do a root canal, retreat the root canal. I want to do root canal second time and third time. I've seen it all. And then place a beautiful white restoration crown for the most part. This is not what body wants. Body will still see it as a dead organ. And I always like to talk about nature, so because we're part of nature. What happens if something, you think of a garden, think of a forest. What happens when something is dead? It's natural, would attract scavengers, fungi and parasites, not to hurt this organism. It's the opposite. It's trying to help in this organism in general. Same thing happens when you get a root canal. Body is trying to help to recycle it. So what we see for those practitioners who have a contrast microscope, they see a lot of infections around those teeth. When I take out those infected root canals, we send it out for microbial testings, and you will see in other slides what we get back. There's a tremendous amount of infections, different type of infections, and very heavy on parasites and fungi, as a matter of fact.
Dr. Emma, can you explain real briefly what a root canal is?
Yes. So we just discussed that every tooth is an organ. It has its own lymphatic flow, blood flow, and nerves. So when you go to your dentist and you say, oh, I think it hurts, it's a little, I have this dull ache here, or, this is a very, very sharp pain that wakes me up in the middle of the night. Traditionally, you will hear things like, oh, you need a root canal treatment. And by the way, once we're done with root canal treatment, you will need a crown. This is very conventional way of looking at it, because in my practice, when I see someone comes in with a pain, we say, well, we'll try to regenerate. There's a big difference in approaches. We're going to talk about it later, but traditional, conventional way, I should say, of looking at it is, oh, so there is inflammation. Let's take all of it out. Let's throw it away. Things that actually help to detox, meaning lymphatics, blood supply, and nerves. We're going to throw it all away. We're going to put synthetic materials, sometimes metals inside. So now what do we have? A shell. It's just a shell. It's a gangrene organ. Naturally, will get darker, blue or green or brown. But because you have a beautiful white crown on top, you're not going to see it. But you don't have pain. So for people like, oh, thank you so much. Now I don't have pain. I have this beautiful crown. And many of patients that I see will ask me, so what is wrong? What is wrong with the root canal? That's how we take a cone beam. I will discuss it later today. Why is it important to take a cone beam? Because we always see some kind of reaction from the bone, either an abscess or some inflammatory process, because your body is trying to wall off from this dead organ. It's your immune system that's working and trying to protect you, in a sense.
And the reason you don't have pain is because they took out the nerves. There's no nerve.
But interestingly enough, those people down the road, many of them will say, sometimes I have sensitivity, some sensation when I bite on this tooth, because even though they took the nerve out of the tooth, our jawbone has a lot of nerve supply and blood supply. Where this infection is spreading in the jaw, every time you put a pressure, you will start to feel some sensations. And then it goes a full circle. They go back to the root canal specialist. They call themselves endodontists. And they will say, oh, we probably should retreat it. What does it mean? They drill a hole in your crown, take out whatever they placed, all these toxic materials, by the way, go again inside and place another layer. So that at this point, the tooth is so compromised, many of them will crack. And I see that actually on a regular basis, the teeth that got retreated for root canal, they get cracks, and then they say, well, I guess the only option right now is an extraction. So we started with something that was reversible, right? So it was just inflammation inside the tooth that could be reversed. They made it irreversible because they removed everything that could help the body to heal. They place something very toxic inside the tooth. It's a dead organ that will attract scavengers. On top of it, there's a toxic load now inside in the jawbone. And 5-10 years down the road, they will say, well, probably it's a good idea to take the tooth out. So my question will be, in this case, why did you have to go to all this trauma and drama of 10 years doing dentistry that's toxic and potentially hurting your overall health, systemic health, going back to gut health by extension and energy meridians by not so much extension, but flow of energy to the organs that connected to this meridian. So just like you said, Dr. Lodi, it's all about energy, frequency, vibration, circuits. If you have closed circuits, so if your switch is on, we have light. Switches off, we don't have light. So we don't have energy flowing. Why? You see here titanium implants, infected root canals, all kind of toxins. I also mentioned emotional baggage is also
So
stored in our.
the titanium implant would block the natural flow, right? And
Absolutely. Well, first first I want to mention that it's never pure titanium. It's because it's somehow in dental labs, and again, they're not evil entities. They just think of what we can add to make it more sturdy. And it's usually the answer is very simple: heavy metals, right? So the same thing with gold. People say, I have this gold, beautiful gold restoration. Okay, in the good case scenario, it's 30% gold. What about 70%? What do you think they added to make it very strong? Heavy metals. Same thing with titanium. They say, oh, it's a titanium implant. Titanium been used in medical field for so many years. But interesting fact is when they use titanium in medical field, it's a different composition. In dental labs, it's alloy and they add tremendous amount of heavy metals. For the reason I still don't understand, again, they're trying to make it withstand all the forces of our, many times traumatic bite and stresses and what's not. But at the end of the day, you're introducing a heavy metal load that will be sitting in the jaw in case of titanium implant or your restorations. And think of every time you're eating something acidic, it will be leakage. It will be leaking, again, by extension to your gut, in the sense of we have a blood supply, right, in our jaw. It will also going to be introducing toxins into the bloodstream, which affects all organs, all distant organs.
When you say a heavy metal like, for example, a titanium, what are those heavy metals they put on, for example?
We see palladium, we see strontium, we see aluminum, nickel is given. It's always the case, aluminum and nickel. It depends. It's interesting. East Coast labs and West Coast labs, they like different things, I guess. But in general, you name it, you will see 5, 6, 7 different metals. And of course, it has to make sense financially, so they're not going to go for something very expensive, right, to add to alloy. So the least the cost, the better. And usually it's a mix of not very clean heavy metals. I'm not even going to go into where they were sourced from. This is another painful conversation. But bottom line is, if you think about it, it's in your mouth, it's in your jaw. You swallow how many times a day, right? But we don't think about those things for the most part.
It's almost like the dentists are looking at this whole situation the same way that people do, and that is that the mouth is not part of the body. If whatever I do here, it's like I'm just going to fix this tooth, but you have to realize that's part of the body. It'd be like doing something here, but really, dentistry got separated from the world of medicine somehow, and we wound up with two professions, which I think is crazy. Because the mouth is still part of the body, and it's probably, think about it. You eat you speak and part of your breathing. So it's a very important part of the body. So I don't know how I didn't study all this stuff in medical school, and dentists don't usually study about the body. It's crazy. Anyway, go ahead.
Yeah, yeah, true. Hopefully one day it's gonna change, Dr. Lodi. I'm I'm hopeful and optimistic.
About everything, I know.
So if you look at this slide, this is what it actually looks like. Extracted root canal on the left side. Can you see the cursor?
Mhm.
If I Okay, so this is where you see all this dark area, the gangrene, what we're talking about, and all this fatty exudate. It's an abscess tissue.
Mhm.
Now, when the patient comes in, guess how it looks? It looks a beautiful white teeth, right? So when people come in and say, "Well, I don't have any pain, my teeth look great. I don't think I have any infections," I said, well, we need to take a cone beam. We need to take x-rays. So on the right side, on the bottom right side, you can see the area around the apex of the tooth. So the tooth has two parts, the crown, which you see in the mouth, and the roots that are embedded in the jawbone. So when we take an x-ray, we evaluate the roots, especially the very ends, we call it apex. That's where usually infection, when it comes out of the tooth, that's where it collects. This patient in particular, she has been going through ophthalmologist after ophthalmologist who is an eye doctor and saying, I have pus coming out of my eye. Can you do something about it? She's been suggested to do surgery, eye surgery. Some of the doctors said there is nothing wrong with your eye. We have no idea why you have this pus coming. So it was draining. She went to ENT, who said, well, I don't know what's going on. Your sinuses, maxillary sinuses, are not at their best, best health, but nevertheless, I have no idea where the pus is coming out of. And she asked, she had, sometimes it feels funny when I bite, feels a little off my bite. Could it be dental? It's dentistry related. It's about my teeth. Most of the doctors said there's no way, pus coming out of the eye. So going back to what you said, it's disconnected completely, right? But if you think about it, what is eye tooth, right? You probably have heard that eye tooth. Why? Because it's in the same meridian. Different cultures might have been calling it different things, but everything is connected. And of course, when she came in, we took a comb beam. We told her you have a root canal treated tooth that got at this point it's a gangrene, it's a dead tooth, but it's also a lot of damage. It's been there for 10 years. There's a huge abscess, and it's draining in your eye. So I guess it's a good thing it's draining. That's why it's not hurting you too much. And she was ecstatic about taking it out, finally healing her eye. And that's not always the case. I have to say that. It's when it comes to women and front teeth, we can discuss this, the root canal, it's a gangrene, it's a dead tooth, it's going to attract the all kind of scavengers. But the people who are motivated, meaning they're already struggling with something in their medical health, these are the people who will take it as, I need to take care of it. Whereas if we have relatively healthy people, relatively healthy, they would say things, we'll keep an eye on it. I was told I can redo the root canal. I was told it might go away by itself and all those things. And unfortunately, it doesn't. It doesn't go away by itself.
When
Here,
you for a moment ago, you said, especially about women, is there something about, because I've noticed this, people are like really more concerned with their appearance really than their health. And so there are, like if they temp, and so a lot of times doing dental work that might interfere with their appearance actually is strong enough motivation for them to say no. I mean, do you run into that sort of thing?
absolutely, absolutely. What I say, especially with women, because for us women, it's the way we project ourselves, right? It's about your workforce, it's about your personal life, relationships. Imagine she already spent a lot of money, she got veneers, she has a beautiful smile, a young woman, attractive woman, and we say we have to take out your front tooth. What do you
Yeah,
mean? I'm gonna have my front tooth? That's
yeah,
end of the world.
right.
So I always say, well, let it sink in. So we'll give you some time, think about it. But as I said, if there's motivation based on the quality of life and overall health, this is where they say, you know what? Let's talk about how we can replace it, because I really want to heal. I want to be healthy. But if there's no motivation here, then it will be more of a conversation. I'll keep it and I'll just wait for it to hurt, and then maybe we'll do something about it.
Mm.
We'll try to save the tooth. So because we brainwashed to think we need to save teeth, we don't have enough. What is gonna happen if I don't have a tooth? Then what? So, and as I said, the concept is we're not saving teeth, we're saving health, longevity, quality of life. That's what I'm all about. Not to say I don't care about aesthetics. Obviously, there's options how to replace the teeth, but this is one of the cases. I'll give you an example. I have an actress who comes and sees me every 2-3 months. She fly in for ozone injections. She says, I know I have this issue. I'm at the peak of my career. I cannot afford to take this tooth out. I cannot afford, meaning time wise, because I don't have this time. I'm actively shooting movies. I can't do this. So I rather have something that will support me until I'm ready to start the surgery.
If you took out a tooth, couldn't you, while it's healing, put a temporary bridge?
Yes. Yes. I don't like the concept of traditional bridges because you have to shave down adjacent teeth. There's
Oh,
a there's a bridge called Maryland Bridge where it's very, very conservative. We basically in the front area in the smile line, we basically attach a fake tooth to inside portion of the teeth without prepping all around. So it's very conservative. It will last a long time now with working with the right lab and doing it the correct way with the bite. I see really good outcomes here. Again, this is all depends on the case. I have patients who will say take out all the teeth that needs to be taken out. I don't care. I want to leave.
yep, yep.
So it's a spectrum. I see all kind of people and the different walks of life, different stages of their careers or healing journeys. So there's no judgment on my side. I have to, accept people where they are. I see myself as an educator. I tell them, this is why you have this issue, and then you will benefit from taking this tooth out. Your body will, I will say, if your immune system has 100 warriors, every root canal would take 25 to make sure it's not spreading. So you have 4 root canals. So what happens with the rest of the body? So that usually gives them a visual of what it does to immune system. Now, everybody is different and we all have different priorities. And especially in Western world, it's all about being pretty. It's all about having a big smile, white smile. So changing this paradigm into longevity, function, and spirituality, this is something I think you and me have in common because this is what we truly all about. And that's a beautiful thing, Dr. Lodi.
And it's unfortunately, the reason that I don't, who knows the reason for anything, right? Because life happens to you. You're not doing life. But I think the reason, or at least the way I look at it, that I wound up working with people that have chronically fermenting cells. I remember I don't like that astrological term that they use for this condition going on inside of your body. And as you know, if you're born between June 21st and July 20th, they say you're a Cancer. If you're before that, you're a Gemini. After that, you're a Leo. So anyway, so if we're going to use an astrological term, let's start calling it Sagittarius instead of the other one. But actually, it's chronically fermenting cells. So the reason I wound up working with that, I think, or not that, that's not why. I did it because God said so. It's my karma, whatever. But is because people in this situation stop negotiating. They say, wow, okay, what should I do? Stand on my head over here for 3 hours and then do, because the reason is because they are faced with something a little bit more important than vanity, and that's called mortality. And when they're faced with their own mortality, they say, okay, I'm going to do what's necessary. And so, and the reason I'm bringing this up right now is because we had a person come to us with a glioblastoma, which is a primary brain tumor, which is, they say, I don't know what they say, 98, 95% fatal, but I think it's about 100%. Anyway, it's very, very, very difficult and it's quick. And so anyway, this guy was actually a surgeon himself. And he said, I've had 2 surgeries, I've had 2 radiation, two rounds of radiation is growing back. I know my prognosis. Can you help? So wound up that he had several titanium implants in the front, had to take them all out, had to take out 2 root canals on each side, all that cleaned the right way, done the right way. And he had to look funny for a while. He didn't care. He's alive. It's been what, 2 years? And it's smaller, smaller, smaller. It's almost not there. Now that just never happens. So anyway, the reason I bring that up is that there is something more important than vanity, the way you look, and that is, are you gonna even be able to look in the mirror anymore? Because, or are you not gonna be around? That's a big deal. Am I gonna be here for Christmas or not? And people we don't appreciate health until it's gone or it's going. And then we start to say, well, and I'm going to tell you something about health. If it's not at the top of your list, when I always ask people, can I see your list for the day? I mean, what's on your agenda? I never see health. It's not there. Okay. Well, if you don't put it at the top of your list, I promise you, eventually it's going to be at the top of your list. You're going to be sitting in a room somewhere, and that's all you're going to be doing is trying to stay alive. So,
So
yeah,
true.
keep that in mind. Anyway, go ahead.
So true. A beautiful story about glioblastoma. I mean, I don't see it enough. I don't see people searching and looking for answers when they hear this diagnosis. It's usually almost like a death sentence, just like you said. Orders to you, Dr. Lodi, once again. Oral systemic link, what research says, right? So one thing I see clinically, another thing what research really backs it up. 60 to 80% of systemic disease arise in the mouth. On the left side, you see an image from cone beam. It's pretty obvious there is a huge abscess around the front tooth. Now you can also see the tooth has a root canal. So this is the tooth, right? This is what you see in the mouth, the crown. Can you see the cursor, Dr. Lodi?
Yep.
And this is inside the white part is what's called root canal treatment. This is how it looks like. This white triangle sometimes, or it's actually gutta percha, not very biocompatible material to start with.
It's like a cement, right?
It's cement and gutta percha both. They have extra cement in the jaw. You see that? That's not a good idea, but for some reason, our colleagues and endodontists absolutely love it. They said, we like to see this little puff coming out, extra cement in the jaw. That means we went all the way up to the apex. My question is, what is it cement made of? It's carcinogenic. There's a very harsh chemicals. So why would you want to have it in the jawbone to start with? Of course, there will be inflammatory response to it. Well, as we discussed, this tooth right now is what? It's dead. It's gonna get what? Black or blue. This is how it looks like when you take it out. Does it look healthy? Absolutely not. Would you like to see something like that in the mouth? Probably not. But this is not what you see because it's in the jawbone. All you see is a beautiful crown on top, white crown. And there's a research saying oral infection can manifest as RA, ALS, a lot of, dementia, Alzheimer's, chronic inflammation, all the way to chronically fermenting cells, autoimmune conditions, irritable bowel syndrome, leaky gut, you name it. All of those things starts in the mouth. It could be your gums are leaking, leaky gut, leaky gum syndrome. It could be all those infections in the jaw that are really making you sick. Along the same lines, this patient diagnosed with MS, breast
CFC.
chronically fermenting cells, insomnia, depression. We take the tooth out. It has a root canal. You don't see the X-ray, but it has a root canal, and you see what they placed inside. Yeah, they're very generous with metal. So it's a metal post all the way up in there. So it was in the bone. What is it? 3-4 millimeters in the bone. Not a good idea. On the right side, you see it just shows you the organs on the same meridian: pancreas, stomach, esophagus. All those organs not having enough energy to heal, which means if there's any inflammation, it will go wild. It will go wild. It's a multifactorial, meaning there's a lot of layers to it. So immune system is overwhelmed. By extension, you have a lot of toxins in your bloodstream. On top of it, by means of those meridians, acupuncture meridians, you don't have enough energy to heal. And then obviously this doesn't look healthy. This patient had irritable bowel syndrome, polyps, arthritis. So it goes on and on and on. Again, another patient. And this is just to show you how on the X-ray we saw a root tip. This is part of the tooth. So tooth was extracted previously, but they forgot a little piece of the root. and it got a lot of infection around it, what we call cavitation. We'll talk about it in a moment. So the patient had a poor digestion, thyroid issue, shoulder pain, trigeminal neuralgia. So when it comes to neuralgias, many times what we see those nerves being irritated by constant toxins released by those infected root canals or cavitation areas. So those toxins release, and in the proximity of the nerve, it is just getting to a point where the concentration is so high, the nerves start to act funky. So some people say, I don't feel half of my face. So it goes towards numbness, right? Sometimes people say it's the opposite. I'm in pain or I feel hot. And you look at it structurally, everything looks good. It's more of a function. We'll look at the teeth around those, we know where the nerves are. We'll look at the teeth that have root canals, and 9 out of 10, you will see 2 or 3 infected root canals right next to this nerve that's responsible for this area of the face.
Yeah, I'll tell you, I've had people with trigeminal neuralgia, and yeah, the pain can drive them crazy. It can really be severe. Let me ask you a question on that previous slide. I think on the right side it said
Go back.
irritable bowel syndrome. Did this person here that you took out the root canal, did they have irritable bowel or any of these?
Oh, you mean after we take it out? So the way I usually like to look at it is, so we address the root cause. So now we'll let the body heal. Sometimes you need help with healing. So it's a good idea to have someone like you who will be supporting them throughout this journey, right? Maybe talk about more about nutrition, lifestyle changes, going to bed earlier, all those, supplementing if it's appropriate, doing some detox. So helping your body. I can't say we take it out next day. Well, I had cases when you take it out, the next day patient says, there's no pain. Oh, I will show you a case where he said the next day his blood pressure got under control, or he got, another patient with fibromyalgia, it got 70% better. But for the most part, I would say, yes, remove the root cause, but your body still have some amount of toxins that need to be cleared. So that's why I like to collaborate with doctors who we speak the same language with, who can help these people.
You know, me personally, I think I've told you this story, but I probably mentioned online before, but I actually developed atrial fibrillation, which was, and then it turned out to be my wisdom tooth had been extracted 25 years. I had no pain, no swelling, nothing. I would never have known it. I did acupuncture meridian. That's the problem. They cleaned it out, took out the pus, all that. 5 days later, it went away, and it's been gone 2 years now. So, I mean, that's pretty quick, and it's pretty.
Yes. Yeah.
And by the way, it's on your heart and small intestine. So meridian. So my wisdom teeth are on the heart. So, if I didn't believe it before, I certainly do now.
Right. Right. So there was this debate and then the debate between conventional dentists, conventional medical doctors, and biodentistry alternative practitioners. Can a chronic dental infection could be a cause of any disease, for example, cardiovascular? And we saw research, yes, it can be considered a cause. So again, there's another case where a patient comes in with a burning tongue, depression, thyroid issue, gut issues, chronic fatigue, multiple root canal treated teeth, titanium implants that very much inflamed and abscessed. So we'll get back to cardiovascular. This is something, it means heart disease. This is, if correct me if I'm wrong, it used to be #1 killer in US, right? Heart attacks and strokes. I think right now cancer is almost at the level of #1 killer. It's hard to say which one, but
Well, there was a Lancet article a couple years ago that showed that the top 21, what they call high income, medium income, and low income countries. So in high income countries, and that's 21 or 26, CFCs, cancer has taken over, but in the rest of the world, it's still cardiovascular. So in those countries, cardiovascular is #2. In everywhere else, it's still #1. But yeah.
Yeah, and if we know for sure that we can, if for people who struggling with any heart problems, we do know the connection to gum health. We do know the infections in the jaw. are really a huge risk factor. We now see more and more research on connection with cancer. So those are two major killers in in Western world, I should say, in the world in general. So why don't we look into oral health as a part of preventative measurements? We don't
Isn't
need to.
there, isn't there one particular organism in the that is directly connected to the heart?
There's a couple of them, yeah, P. gingivalis and Treponema denticola. Some of them are really a lot of research where we see association. So we've been trying different approaches, meaning checking the gums for specific bugs. But
Mhm.
at the end of the day, since we're gonna use ozone, it doesn't really matter,
Right,
right?
right.
Ozone being antibacterial, antifungal, antiviral, antiparasitic, immunomodulator, regenerative capacity. So it will help. So we kind of stopped doing it. But that
Sure.
was interesting. You're right. There are certain organisms that are associated with high risk cardiovascular issues or cancer, as a matter of fact.
And then ulcerative colitis or something. There's a
Yes.
yeah. So
This is actually a slide about colitis. Yes, periodontal bacteria, so bugs that causing gum disease, they do cause colitis. It's the same bugs. And once again, we talked about it, it's the same organ. By extension, every time you swallow, you introduce in your oral microbiome to your gut and they talk to each other. So we know now that gum disease make worsen your irritable bowel syndrome. It can accelerate growth of tumors. It's debatable if it's the cause because it's a gray area, but it definitely accelerates growth of tumors. And this in the same fashion, oral bacteria associated and found in the Alzheimer's affected brains. That's
mm,
interesting, isn't it?
mm.
Because if we see that, wouldn't it be smart to start prophylactically looking into gum disease and oral health, all these inflammatory risk factors early on and try to reverse the damage? Just again, food for thought. Oral disease, systemic ramifications, breast cancer, let's avoid this word,
CFC.
CFCs, insomnia, depression. This is interesting. In research, we see 98% of patients with breast chronically fermented cells have upper molars that have infected root canals or mercury fillings or incompatible restorations. So some kind of problems with upper molars. Clinically, Dr. Lodi, it's 100%.
Yeah,
Maybe research will say 98, clinically 100%.
yeah, yeah.
So this is how it looks like. So on the x-ray, we see what? We see a root canal treated tooth. You see this white area in one root. It's a multi-rooted teeth in the back and dark area infection, dark area infection. Now, infection, by the way, spreading to maxillary sinus. And this is what it looks like when you take it out. And this is the abscess.
Mm,
Do you
mm,
want to have it in your mouth? Probably not, right?
mm.
But for some reason, when you talk about it, I want to get a root canal treatment and I want to get a crown. It sounds pretty innocent, but when you look and see what happens here, it's a gangrene, and it's really causing those breast tissues not having. I don't want to say causing, but definitely adding to a problem.
Well, let me add in right there for a second because and this is one story that I think is really important. I had a woman with inflammatory breast. I hate the word cancer, inflammatory breast CFCs, which is really aggressive, moves quickly. And so she was going to go to Sloan Kettering. I was in New York. She was going to go to Sloan Kettering for a clinical trial. And I reminded her that's a euphemism for experiment. She said, okay, it doesn't matter. So she was going to go. And I said, well, please let me look at you first. So I looked and she had a root canal over here, right side, breast meridian. I said, please get this taken care of. So I sent her to a good biological dentist. She got it out when she went about 6 weeks later to Sloan Kettering to begin the clinical trial. They said, "I'm sorry, you're no longer eligible." So I mean, just that, and so they are important. And I mean, and the other doctors I work with can attest to this. I mean, everybody we talk to. I had a guy last night from Brazil, and he's got colon CFCs, and he tells me he's got these implants on all colon meridians, upper and lower. I said, well, if we don't take care of this, then whatever we do won't matter and it won't work. So that's why now in the way when I work where I work, you got to take care of that first. Otherwise, why do it? It's like can you imagine having a big abscess and you just putting a little bit of vitamin C on top of it? It's ridiculous. So anyway, that's how important it is. And
Yes.
thank you.
Yes. Well, I really appreciate you recognizing it because I still feel like even in holistic world of practitioners, it's it's maybe mentioned, but it's not stressed enough. So not, I don't see a lot of practitioners like you at all, as a matter of fact. So this is what comes back when we send those infected root canals for microbial testing. We call it biopsy, but essentially you see the names of the bugs. Some of you see endamoeba species, which are parasites. You see TD, Treponema denticolits, or bed bug associated with a lot of damage to cardiovascular health, to your gut, to Alzheimer's and what's not. And when we show it to, when I share it with their providers, for the most part, people say, "Well, I'm so happy I got rid of it." So it's a root cause. That's what been brewing around those roots of the tooth. But that's where, following up with a detox is so important.
Mm.
I feel like my patients to have that. So this is today we're going to talk about gum
Excuse me,
disease.
Dr. Amos, excuse me. You mentioned there you had entamoeba. What what percentage would you say of the of when you get back those reports that what do you think what percentage have because everyone needs to understand that entamoeba is a protozoal parasite. It's like if you've ever had amoebic dysentery, and that's what amoeba is. But what would you say what percentage have protozoal parasites in their?
I'd say 75 to 85% of cases.
Okay.
But we'll have, it could be that's the most common parasite we see. We see spirochetes, anaerobes, bugs associated with damage to the brain, meningitis, very high H. pylori. Not to say that's the only concern that I have, the stomach health. But nevertheless, you will see, viruses. This is a gray zone, but many times I will see HPV,
Mm.
high. I don't know how exactly to interpret it,
Mhm.
Dr. Lodi, but I
I,
see HPV 58, and it's really it's
You
a
know,
high
let me ask
concentration.
you another thing that's always, I'm always, I just don't know the answer to. Suppose somebody has root canals in places that's not, they come in, let's say they come in with breast CFCs, right? But they have root canals on a different meridian. I still think they need to come out because I mean, when I talk to some, like, for example, in the United States, the biodentist that we were working with was saying, well, no. If it's not on the meridian, we can leave it. And my feeling is we can't. We have to get that out too. What do you think about that?
Well, just like with blood vessels and nerves in our body, we talk, they cross, there's a cross sections in different parts of our bodies. And sometimes they cross midline, other times there's just very individual parts where they have extra branches. So in my mind, if I know someone is going through the treatments for chronically fermenting cells, and even if the tooth, the infected root canal, whatever the problem is not on the same meridian, but it could be possibly interfering, I would definitely say this person will benefit from
Because at minimum, it's like you said, it's taking 25% of your or 25 of your what's it
white
called?
blood cells were, yeah, what immune system warriors, yeah. So we're not overloading immune system, we're not introducing this toxicity to your gut by extension. So in any case it will get better. But it's very interesting that you mentioned that, because I do see how sometimes those energy meridian, it's not a straight line, so it will go from one side then across to another side. And even though we do have those simplified versions, when we say this is a straight line, it goes through those organs, sometimes it's more than that. And as you know, in TSM, traditional Chinese medicine, many organs are combined, right? So we don't look at kidneys not as separately.
Mm.
We look at kidneys and adrenals, right? So it's just our bodies, everything is connected. So I would not separate it when we look at, even though we do have energy meridians, and I do like those graphs too, so people will visualize it. I still have to say it's much more intricate. It's not just a line going through the one organ only,
Yes,
right?
perfect. Perfect. Yeah, no, yeah, beautifully said, because that, that's true. And that's really, everyone needs to remember, we don't have a cardiovascular system and a gastrointestinal system and a kidney, because by the way, if you don't have a lung, your heart won't work. And if you don't have kidneys, it won't. So there's one system. We divide it up because why do we do that? I don't know why we do that, but that way we can talk about it, I guess. But really, it's one system and you can't separate it. So I love that. Yeah.
Yeah. So, oral disease, chronic inflammation, we see sort of markers, right, in the mouth, and it's all about disruption of terrain. Chronic inflammation will manifest differently. So, for example, periodontal inflammation or gum disease. Well, what we mean by gum disease is where the teeth lose partially or more so its support. So you can see when a healthy tooth has a bone support and a healthy gum. So gingivitis is where the bone support is still there, but there's inflammation in the gum compartment only. So mild, moderate to advanced, we see more of a bone being affected. You're losing now bone, you're creating those we call pockets. And it's almost like a vicious circle because it's very hard to clean down there. So why are we talking about periodontal inflammation and gum disease as a part of chronic inflammation? Well, because all those toxins, all those anaerobes and other bugs who live in those pockets, they constantly release toxins in the bloodstream. So that's why we see dental pathogens in the brain, in the gut, in the tumors, accelerating growth of tumors. It can be any organ, even distant organ. And of course, it's affecting the immune system.
So
Now,
what do you think causes, I mean, what usually causes that?
I would say if you want to address gum disease, you need to address your gut. If we were going to peel out all the different reasons why, it could be you have, some people say it's genetics, some people say it's my bite, other people say it's my diet. But if we're going to boil it down to two fundamental reasons, it will be not enough oxygen, which comes along with not enough microcirculation or blood supply, and too much acidity. So how we counteract it will be introducing oxygenation treatments and introducing oral hygiene protocols that will make your mouth more alkaline. This is truly addressing the root cause. I'm not a big fan of surgical approaches unless it's needed, right? So if we can gently change the terrain, because we used to look at the gum disease, oh, it's too many bugs, so we're gonna use some harsh chemicals to kill the bugs, and this makes things worse because you killing the bugs, the fungi level goes up, you have all these mold species and then parasites, and it's just getting out of hand, all this microbiome, which by extension affects the gut microbiome. And going back to the gut, why we keep on talking about the gut? Well, gut is where your immunity starts. This is your mental health, all the happy neurotransmitters, 75-85% are produced in your gut. Hormonal health, digestion, nutrition. It's basically the start of your health. This is where we start. And if you have bleeding gums like this, the last thing I need to prescribe you is a surgery, right? It's how we can address your lifestyle, how we can address your health, work on your microbiome, work on nutrition, some very gentle oral hygiene protocols so we can start. And are all about baby steps, because if we see a situation like this, it's got to be some underlying medical condition. There's no way we see that much destruction to your gum health and underlying bone in this case without underlying condition. And many times it could be something what's called autoimmune conditions, something like leaky gut, or I see a lot of patients with chronically fermenting cells with chronic inflammation in their gums, were very, very stubborn ones. So they keep on working. I say, it's your chronic inflammatory it's very you very acidic, in other words. So we talk about what spirituality, we talk about emotional health, right? So just like we started our conversation, if you're constantly stressing, if you're in a fear mode, guess what? You're dripping cortisol, adrenaline, everything, your body goes in this acidity mode, and the body will pull minerals from your teeth and the bone, underlying bone, in this case, jawbone, to counteract acidity. Of course, you're going to lose bone.
Yeah.
So in this case, it's just really addressing all three, mind, body, spirit. So not just structurally, locally, it has its place, but also looking at it like zooming out and looking at, okay, how we can address the stress, the health of the balance of nervous system, right? Autonomic nervous system balance, going away from fight or flight towards rest, digest, and heal. And this is really fundamental in this case.
Well, and the gut biome, we have to understand that. For example, if I don't have a heart, I can't live. If I don't have a liver, I can't live. If I don't have kidneys, I can't live. And if I don't have these guys in these 100 trillion microorganisms in my gut, I can't live. So then the question becomes, are they them or are they part of me? Is it us? And we have to really look at it that way because, I think we have to redefine what we are. And what we are is not this thing that's separated from our environment, and our environment is not only that stuff that's outside of us, it's inside of us as well. So you can't separate it. We're all part of it. I mean, there's the word context. So imagine you see a person walking down the street, right? And oh, it looks nice. They're walking on the sidewalk. Now, if you could do this, take away the background, and what do you see? You just see a person with two legs. It has no meaning. It loses its meaning. So anyway, the point is that context gives the reality to the thing you're looking at. We always look at the thing. So exactly what you're saying. So if we don't have a healthy gut biome, then of course the mouth is part of the gut. It won't be healthy. And then also the microorganisms that go up into your nose and your sinuses and all that won't be healthy. And just like in the gut, if the gut's not healthy, as you all know, the rectum is near the vagina and the vaginal biome won't be healthy. And so it's really the gut is central. And I agree with you 100%. And I think probably in every field, whether it's dentistry, medicine, pediatrics, whatever you do, I think we should be addressing that like initially, whatever else we're doing, but we don't. I don't know why, but we don't. And I finally, though, we're all starting to see that it's coming into the literature, it's coming into dental literature, it's coming into medical literature, and we're starting to understand how important it is to reestablish the gut biome. And one interesting thing I just want to throw in, and then I'll shut up, and that is when we look at how do we fix the gut biome? Well, we're going to give you more probiotics, more probiotics. Well, what we've learned actually is that what's more effective than putting in healthy bacteria is giving the prebiotic, which is actually the food for the bacteria. So they give inulin and all these other things, but they only have to give that to people who don't eat human food. So most people on the planet eat dog food, and so you have to give them inulin and you have to do all that stuff. But if you eat human food, which is, by the way, in case you don't know, plants. Anyway, so if you're eating plants, uh, the bacteria that the microorganisms that would support us, they love plants. And if you eat that, they're going to just flourish. So it's what you eat will define what the relative proportions of the microorganisms in your gut. That's what will define it. So if I'm eating fast food all day long and taking probiotics, they won't find anything to eat, so they're just going to come on out. We have to understand that. Anyway, sorry for taking up
No,
so.
no, that's beautiful. That's absolutely beautiful. That's what I talk to my patients a lot. We want to create a garden in your gut. And this
Mm,
garden will produce all this beautiful interactions, just like what you said, with a possibly more intelligent part of us, this
mm,
microbiome. It's
yeah,
on our skin, in our lungs, in our mouth, in our gut, all the different parts of us. And combined, they create our perception.
it's
And and it's very interesting. I would say not a lot of people talk about it. So all this agenda killing the bugs is really we're killing ourselves, not the bugs.
there are no germs. We say germs as if it's a bad thing. There are none. There are none. I just real quickly, there was a guy that in 1856, I think is a man by the name of Rudolf Virchow. He's called the father of pathology. He wrote the first book on pathology. I think it's called Pathological Basis of Disease or something. Anyway, he used the microscope and all that. He did autopsies. So he developed the field of pathology, which to in the medical field is they're considered the doctor's doctor. You know, like we cut something out, let's ask the pathologist what he thinks. And so that's so he wrote the book and he said, if I had my life to live over again, I would devote it to proving that the microorganisms are there to clean up the mess. They didn't make the mess. I love
Yes, I agree. That's beautiful. Beautiful. Literature. So there's a lot of literature how periodontal disease, in other words, gum disease, is associated with cardiovascular disease, endocarditis, ischemic heart disease, heart failure, atrial fibrillation. And think about it, 1 in 2 adults in US has gum disease. Advanced. That's the
wow.
recent research.
Advanced. Wow.
Moderate to advanced, moderate to advanced. And it's again this chronic inflammation of a supporting tooth structure, what we call gum disease, is also associated with chronically fermenting cells, any type of inflammation in the body, and or degenerative diseases, lung, diabetes,
Wow.
metabolic disease, RA, a lower birth weight, preterm babies, you name it. So that's why hopefully medical elite will look into addressing or at least making sure patients will see a dentist, ideally biological dentist, to check their gum health. If we can improve their gum health, all those things could be preventable.
So 1 out of 2. That's
1/2. This used to be 1/4, then 1/3, and the most recent research 1/2 adults.
so I wonder that so if that's moderate to severe, then I guess then there's even more that have a mild.
Well, yeah, they say most, well, 99% of us have
Yeah.
some form of gingivitis. I remember on my slide where we had gingivitis, it's beginning of it, so we still have a good bone support, just a little more inflammation in the gum tissue and the soft tissues. This is most of us. This is where we are. Now every 1 in 2 will have moderate to severe. So moderate. So where we're losing the bone support, and many people they call it, and many dentists will say that, well, you have a little bit of recession, and it sounds so innocent, but
Right.
what happens is because of inflammation, you lose your gum line. So all of this going down, and you see part of a root structure exposed. So
Yeah.
this is moving into moderate gum disease, but it's called recession, gum recession. And I always tell people, okay, let's think about why would you think gum will recede? It's actually bone shrinking and gum will follow, right? So what is it happening to the bone that this beautiful living tissue will start shrinking? Again, not enough oxygen, not enough blood supply, microcirculation, and too much acidity. In the oral cavity, I will also add trauma, mechanical trauma, clenching and grinding,
Yeah.
stress, emotional stress. So again, we can look at it at different levels, mind, body, spirit. But essentially, when we lose bone or gum recession situation, this is more, we're moving towards moderate to advanced gum disease.
And this picture you're showing is mouth is the whole mouth. But if it's localized, and I just want to give an example from in my life, I've got a couple areas in my mouth where I've got local gingivitis, and it's right where I went to this is what they, I guess she calls herself a dentist. Anyway, I went to this dentist in Thailand here, and they put in. I had to get a cavity filled. And it's a little small place. She painted the whole tooth with whatever it was. And right in there, I got an inflammation. So back to biological dentistry. Biological dentistry, probably one of the foundations of biological dentistry is biocompatible material. So a biological dentist will draw your blood, send it off to a special lab that's going to compare it to like 3,000 or more different dental materials and find out if you have even an idiosyncratic, like only you have this reaction to a material, then we're not going to put it in your mouth because that reaction will cause chronic inflammation. And so that is I think, that's one of the foundations of biological dentistry, is to make sure we don't put anything in your mouth that you're going to have a problem with. And obviously so in terms of gum, if it's in one place, I think you can look for something right there, right? Can you look for something?
Yes. In this case, it's just here, it's what we call generalized problem, meaning it's everywhere,
Yeah.
right?
Mm-hmm.
It could be is just on the one side or one quadrant, upper right side, lower left side. Sometimes it's one side. And yeah, we see that a lot. Recession more so in the back area or in the front area, or those eye teeth cuspids. It
Mm-hmm.
could be it could be just a couple of teeth, doesn't have to be all of them. Again, this is just to show literature. There's a lot of research where it's a proven fact. This is the same pathogen, the same bugs. I don't want to say bugs because it's microbiome, it's all different species they found in distant areas. Another form of inflammation, infection in the mouth, it's what's called cavitations. What is cavitation? Cavitation is it's the area of a hollow cavity, in other words, in the jawbone. Many times it's in the areas of previously extracted teeth. And you can see, imagine there was a tooth right here. The tooth was extracted. On the top, you see the gum heals beautifully. So when you open your mouth, you see the area of the wisdom teeth. This is the most commonly extracted teeth. It's healed. But what's going on underneath? This is inside the jaw. There is a area where it's incomplete bone healing. So the bone never truly filled the area. This is called cavitation. We see a lot of research where now cavitation as a term being discussed, what it is and how to treat it, as opposed before it was looked at as a quackery. So there's no such thing as cavitation. So we actually see research saying cavitations are common from different parts of the world, and there's a different names. It could be called NICO, incomplete bone healing. It could be called osteomyelitis, or infections in the jaw. And think of those cavitation areas of infection sites. So for your body, it's the same infection as if you had a inflammation on your finger, or once again, we always talk about toes and gangrene on your toes. So it's the same manner. It will attract your immune cell warriors trying to counteract infections. So it's really common to see those areas. In other words, another way of calling them will be hidden infections. So we take a cone beam scan to look for those infections. But it's really something I want to show you, a research coming, as I said, from different parts of the world, proving the fact of existence of those cavitations and what are possible complications from sepsis to thrombosis and loss of the bone, of course. This is how it looks like. So imagine on top of this bone, there is a gum, right? So gum will heal, so you'll have a pink gum. Then you have a healthy bone, but maybe very thin layer of healthy bone on top, but underneath, you see this area, it's a mushy and soft, it's not hard as a healthy bone. And many times, because we have a nerves in the jawbone, very to the corner of the jaw. Imagine it was a wisdom tooth all the way in the back. So this area will be it's an area of infection that will be constantly releasing toxins, irritating the nerve. So that's why another way of calling it neuralgia. Neuralgia induced cavitational necrosis, or NICO.
And
People
don't they call it
fatty degenerative disease. Yeah,
uh,
there's so many
yeah.
different ways of calling it, but this is what it looks like truly in the bone.
Mm.
And when we open it up, we clean it out, and we'll get there, but this is what we want to see, right? This is how it should look like. If we completely clean it out and help the body to build new bone, it should heal fully. People will present with everything from no symptoms whatsoever. So it will be accidental finding. Oh, we see on the cone we have cavitations. We will say, I don't feel any pain. I just had my wisdom teeth extracted many, many years ago. But that's pretty much it. It was very straightforward. I healed in no time. And this is what we see. And the opposite side of the spectrum will be people struggling with chronic pain, neuralgia. and they will say pain is started after a root canal treatment, or pain started after wisdom tooth extraction. And interestingly enough, our colleagues will not believe these people. Where they take a look at X-ray, regular dental X-rays will not show this. We need to take a cone beam, 3D X-ray, and they'll say, I don't see anything wrong with this area. It's in your head. And we'll always joke about it is in your head, right? but it's not. But it's not necessarily what they mean.
Right.
And those people will be on all kind of drugs. I've seen antidepressants for 13, 14 years because of imaginary pain or phantom pain. They say it's a phantom pain after extraction. Not really, not really. It's just this nerve can go either way. All these toxins can make it really exaggerate the response when you feel pain or burning sensation in the face or in the mouth, or the opposite. So you have a numbing sensation. I don't feel my tongue. I don't feel my lips. So this is what we see with cavitations. Now let's look at the literature. The one marker of inflammation is called CCL5 or run test, depending on where you're at, Europe or United States. But the idea is this: a lot of chronic inflammation in the body will have, when you have chronic inflammation in your body, you have increased levels of run test CCL5. So if we look at this marker specifically, we'll look at it being very high in patients with chronically fermenting cells. We see it very high in patients with cardiovascular disease, and cavitations arguably can be number one cause for this high levels of this, specifically of this marker, because as you look here, run to CCL5 overexpressed in those areas of cavitations. So it's 30 times more in the area of cavitation than anywhere else. So if you think about it, if I were to check this area, it will be 30 times more run test than anywhere else. If I see that, we can indirectly say, well, you have a chronic high chronic inflammation rate. So let's try to address that.
Yeah, and one thing, for if there's any dentists that are watching, or regular dentists, from what I understand, I didn't go to dental school, and help me with this. From what I understand, regular dentists see these cavitations, but don't even address them, don't think that they have any relationship, right? They don't, they were never taught that cavitations are a problem. Is that true?
Right. Right. There's no such a term cavitation. They will say, well, when you took your wisdom teeth, we see in the area it's still not fully filled with the bone. That's if that, they might not even say that, but they see it. Of course they see it. It's not, bone density is different in this area when they take a beam especially. It's not very easily diagnosed on regular x-rays, I have to say. So if you go to a traditional dentist who takes regular dental x-rays, it's hard to see it. Once you get a look at a cone beam, it's a different world. You cannot not see it. Now the question is what you're gonna do with it. So one thing is seeing very low bone density, and people who are curious who will say, I wonder why I see that, and why is it that sometimes it's causing pain or numbness, other times it doesn't, but it's always affected. And then once you open and see what's actually in there, all this fatty degenerative tissue, and you drain it, you see it once, you cannot unknow what you know and how it affects the body. I just hope our dental community will wake up at some point and will just call things what they are. You see low bone density, you talk about possibility of infection and how to address it. There's many ways how to address it, but just opening the conversation about it, I'm hoping that's where we're going to be going.
And one of the causes that I've seen, I'm sure you know them all, but one cause that is completely overlooked, and that is when a regular dentist does an extraction, they pull the tooth out, they squirt it with some water, they give you some gauze, and they tell you to go home. And so the gums grow over, and meanwhile, all the billions of microorganisms that were in there are still there. Now it's closed over, and they didn't take out this ligament, the periodontal ligament. So for everybody listening, tendons connected to bones by fibrous tissue. Muscles are connected to bones by tendons, which is fibrous tissue, but bone is connected to bone by what are called ligaments. So our ankle bones have ligaments, and our knees have ligaments. So that tooth is connected by what's called a periodontal ligament. And isn't it true that they don't remove usually the periodontal ligament when they do extractions, right?
Yes, yes, yes. You said it absolutely right. It's not a part of a procedure. The idea is to take the tooth out, and that's the extraction in conventional dentistry. When we talk about biological extraction, taking the tooth out is a portion of a procedure. Then we have to work on removing the ligament, because if you're not going to remove ligament fully, what's going to happen, as Dr. Lodi just explained, that the gum will heal on the top. There will be some area of a bone laid on top of it, but inside this remnants of ligament will not let, and they're infected, right? So they will not let the bone to fully fill the area. So it will be some area of incomplete bone healing, or another way of saying cavitation, right?
And that ligament is like for the microorganisms, it's like a bridge right into the jawbone.
Yeah,
It's
yeah.
like,
It's harboring all the microorganisms, more so than teeth, actually. So
yeah.
that's why we send it for microbial testing. We send not only teeth, but also partially ligaments. Yes, so this is about Randes. This is what we do. We curate all the diseased tissue, laser, ozone, use PRF. PRF, when we take your blood, centrifuge it, get different fractions, and we need stem cells and growth factors for the most part. Supplement, hyperbaric chamber. Again, oxygenation, improving microcirculation, making sure the area is alkaline. That's what that's what the main goal is. And this is what it looks like. In this case, again, root canal treated tooth, huge abscess. This is how it looks like on the cone beam and a different projection. And this is a picture of a fatty exodus. So we took the tooth out, and this is what comes out. Now, I usually use laser, so I put my laser tip inside the socket. So the idea, we're creating a vortex. Why? So we're using physics and chemical approach. So creating vortex, so everything will come up to the surface. And you will be surprised, 90 seconds later, this is what comes up. So look at this x-ray. You see how huge it is, all this inflammatory area. So we took the tooth out as much as we can. We clean, mechanically debride the area. Then we use ozone, we use laser, and still I put my my tip inside. 90 seconds later, this comes out.
Wow.
Imagine if it will be conventional dentist. You will take the tooth out, as you said, put a gauze, and goodbye. What's going to happen with all this? In a healthy body, we can arguably say, well, the body will try to drain it. The healthy body, healthy immune cells will come and clean it up. Macrophages was not. But how long it will take it? And what if we say the patient is not truly healthy? Then why we need to put this patient, this body through the stress? We can mechanically remove this. I put all the good growth factors, sprinkle with calcium hydroxyapatite to help the body to build bone, and then let the patient go. Suture it, by the way, not let it open. I'm not a big fan of leaving anything open in the mouth. And then we can see results. And again, same of, and on this slide, I want to show the difference. When they take a regular dental x-ray, this is a tooth that has a crown and the root canal, very typical. On the regular dental x-ray, the dentist says, well, I kind of see something around the apex. Looks a little odd. We'll keep an eye on it. Now on the left side, this is a cone beam. This is the 3D scan. You see clearly both roots have abscess, both of them. And this is how it looks like when we take it out.
Wow.
And this is, by the way, microbial testing, HPV 58, very high, and amoeba, TD, Treponema denticola, all these nasty ones. So this is, again, importance of taking a 3D scan. If you go to a dentist who doesn't have a cone beam in the office, or he doesn't refer you to imaging center to get a cone beam, in my mind, it's a red flag. I would say a standard of care should be, it's still not there, but should be, start with a data collection that shows enough information for you to diagnose. If I see this x-ray, I would also say, doesn't look right. I just intuitively say, because it has a root canal, it needs to be out, right?
Right.
But nevertheless, if they go to even biological dentists who don't look at the cone beams, unfortunately, there's still some, it will be 50-50. You might hear different opinions. When you see that, there's no way it could be any other solution other than taking this tooth out.
You know, I got to tell everyone this too. Even the ones, the dentists, the biological dentists who do the cone beams, they don't all read them the same way, because I have personally had cone beams done by a biological dentist on a patient and sent that sent that file to Dr. Emma, who is able to see things that they didn't see. So that's, there's another layer of problems. Just because you do a cone beam doesn't mean you really know how to read it correctly, because they have software in there where they can actually measure bone density and stuff like that. So it should be a standard, but sadly it's not. So that's why it's very important when I speak to all of you, when you come in and we talk about seeing a biological dentist, and you say, well, you can't fly, you're not going to go anywhere, I have to stay in my area. I say, well, look on the website and just, look under services, and if they do this, they're not biological. If they don't do, so, but even then, you don't know if they even know how to read cone beams. And so, Emma, how long have you been looking at cone beams?
I'd say for many years I've been looking at cone beams, and again, I guess my frustration came with the sending out the X-ray, the cone beam, to a third party. There's a company, it's called Beam Readers, where there's a bunch of radiologists will read it.
Mhm.
And my frustration came with the fact that what they see is completely different from what I see. Then you start asking questions. Who are those radiologists? Many times those are retired dentists, retired conventional dentists, right? Or radiologists who train in a very conventional dental environment. So they're not going to pick up cavitations. They will say, oh, looks like a little incomplete bone healing, if that. Many times they're not going to mention it. Are they going to look at the airway? Lately, yes, they finally start looking at the airway, but they're not going to look into those things that really matter to me. And so that's where, getting trained, being curious, asking questions, looking for people you can learn from. I was blessed, Dr. Lodi. I had amazing mentors, and I don't want to take all the credit. There's incredible people in this country and in the world who know so much, but this is you wanting to go extra mile, invest your time, money, and effort into learning things so you can bring it to your patients, right? And doing it at a level where you feel confident you are helping people, versus relying on some radiology report of person who doesn't know your patient. They don't even care. They're not trained to look for those things. They will say something like, well, the root canals don't look really promising, but at the same time, it will be up to your discretion what you want to do with them. Is it a lot of information? I don't think so, right? But it is what it is. It's a standard of care. If you do a cone beam, you send it to radiology, you get a report, and this is a legal piece of information you're supposed to base your treatment plan on. And
Now,
sorry?
go ahead, go ahead.
And I respectfully disagree with everything they say, almost everything they say.
What I wanted to ask you is that dental radiology must be like a subspecialty of radiology, right? Like, so a regular radiologist is not going to really learn how to read dental, like cone beams. Right?
I would assume so. Yeah, I don't know much. I do know those radiologists, they have training through in dental schools, not medical schools. But who trains them? What are they looking for? That's my question. They don't look at things I'm looking at. They don't look at nasal passages. They don't look at maxillary sinuses. They might say there is a tumor growing in the sinus. So there's something very drastically different from norm, then they would pick it up. But for me, if I see narrow nasal passages, this is something I want to bring to the patient attention. Oh, can you breathe through your nose? Right? Or joint position. They will say there's some inflammatory processes in the condyles, which are part of the jawbone. Okay, it doesn't give me enough information. When I look at it, I look at the position and then all those things. So it's not about me that much. It's about I'm trusting someone else who I'm not sure what they train in. And if it's a retired conventional dentist, they don't even look at 90% of things we look at. So it depends who you send it. And I guess my experience pushed me into doing it myself.